Well, hello, everybody. Happy 2025. For those who don't know me, my name is Dr. Aminola Dada, and welcome to the Healthy Joints, Healthy Lifestyle Show. Today, I have an amazing physician. He's a podiatrist, Dr. Mari Adad. He and I have had patients in common. Can I say 20 years? I think.
Absolutely. Yes.
Absolutely. Yeah. So we have the pleasure of having Dr. Adad. He is a podiatrist, and together we have taken care of tons and tons of patients. So he is in the greater Seattle area. I am going to give Dr. Adad the opportunity to introduce himself and welcome him to the show. Thank you, Dr. Adad, for making this show early this morning.
Oh, yes. Thank you for inviting me. I appreciate the time and uh, uh, talks here to give you and your patients information that's helpful and things you can do at home for foot and ankle issues. I've
Perfect.
been in practice here for over 30 years and certainly a wealth of experience, a lot of foot injuries. I'm board certified in foot surgery, and I do, however, like to care for patients conservatively, exhaust all conservative measures, and keep people running. I have a sports medicine fellowship trained degree, and so I like people staying active, keeping the healthy lifestyle going.
Love it. Um, in addition, I know that you are specialized in 3D digital scanning for custom molded foot orthotics. Can you tell us more?
Oh, yes. So a lot of foot problems can be alleviated with certainly proper shoe gear and additional inserts, foot orthotics, as they're called. They are designed to make your foot function more efficiently. So, yeah, the previous methods to create these devices would use plaster molding around your feet, and then I got to hold that for about 10 minutes till they dry in the right position. But in the last you know 10, 15 years, the technology has caught up. And so we do everything three-dimensional digital scan, basically scanning your feet in three dimensions to capture the position of the foot to provide that proper support, proper um, control so that you don't have foot issues. And they can be used for many different conditions. Primarily, the number one treatment alleviated with the custom orthotics is heel pain. However, I do adjust for joint pains as well.
Okay. Okay, good to know. Because there is a big world of difference between just picking up something at the store on your exit out of the grocery store, thinking that you're getting orthotics for your foot, and actually getting something that's specifically designed for you, right?
Oh yeah, yeah, for sure. A lot of times these over-the-counter supports have some benefit, but if you are really having persistent foot pain, yeah, you need to have something customized to you.
Yeah, that totally makes sense. Okay, so so we did a survey, and we knew that you were going to be on the show today. So we asked patients of ours what questions they wanted to get answered. So one was what are the common causes of foot joint pain? And how are they typically, and that feels so broad, but I'm going to just kind of let you kind of narrow to like maybe the top one or two most common causes of foot pain, and and kind of how do they develop? I guess more like how do you prevent them, right? Number one and two.
So I would say the number one foot joint pain that comes into my office as it revolves around the great toe joint. And the two main things I would say, which I send for you to evaluate once I discover this, is gout. Gout definitely is one of the things that comes in as great toe joint pain. Very typical appearance comes in. The all sudden onset, red, hot, swollen joint, and most often if they don't have a inciting injury or incident that happened typically happening overnight, these sudden pains. Then I start questioning, what have they eaten before? What's the most recent change in your diet? And a lot of times I'll find that they've all of a sudden had shellfish that they haven't had in
Mm,
a while, which
mhm.
actually happened just the other day. This patient said, "Oh, I was visiting out of town with family, and we had this shell feast."
Ooh,
shellfish feast.
feast,
Yeah,
feast,
feast.
feast,
So,
feast.
so that's one of the common things. So in those situations, obviously, I get him comfortable and then send them to you to isolate what causes they have, maybe change their diet. I also give them a list of foods. But another common joint pain, secondly, is arthritis in the joint itself. Now, that can be developed actually from history of repeated athletic activity. A lot of times, soccer players kicking a soccer ball over a lifetime
Yeah.
develop
Mm-hmm.
arthritis. Sometimes even just running, runners,
Yeah.
sprinters, just overuse, the joint starts to wear. And a lot of times those situations can also be alleviated if you're in the proper shoe gear for the right activity. But sometimes injuries you can't prevent. They happen when you play sports, and these arthritic changes develop. So,
Yeah. 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 So, when you talk about the gout, of course, that's one of my passions. And I treated, I think, a number of patients together. Some of these gout patients, it's been so severe and for so long that they have these lumps that I think we've managed together with medications. We can shrink it. And sometimes it actually causes like the joint to become unstable. And so, I think together with the podiatric surgeon, we have managed to one get rid of the tophi, but two also think make that joint useful again,
yes.
right, and stabilize that. So it's
Yeah,
been
yeah.
it's been very fulfilling, I think, seeing these patients and kind of managing them with you, so that they can just live their best life and not really being at the mercy of the shell food feast. Even saying that gives me like the hippie jibbies.
That's for sure. Um,
Yeah.
On the
Okay.
other side of things, the with the joint pain, if it isn't gout, for example, uh, there is conservative care as well, short of surgical solutions. A lot of times, the joint that gets arthritic, patients see other doctors and they suggest, you know, surgery, fusion to get rid of the pain, which certainly would work, but that gives you a lot of downtime.
Yeah.
What I've done is to prolong or preserve the joint as best possible with
Yeah.
a series of injections of what's called hyaluronic acid. There are
Yeah.
different methods, different types of hyaluronic acid, but definitely it's out there. It's a joint series injection. I typically do 3 injections. They're done once a week. Gives you 90% of pain relief, can last up to a year, and
Okay.
you can go about your life without really limited discomfort.
Yeah. Yeah, that's something that I typically request your help in, because I don't have that skill set. So always, great to have that option. And so where would you inject the hyaluronic acid into? I understand the first toe, that's most common. Any other joints in the foot that you would inject the hyaluronic acid
Oh, absolutely.
patient? Yeah.
Certainly the most common is the big toe joint, but patients
Yeah.
come in also with ankle joint arthritis or
Hmm.
even other joints in like in the mid part of the foot. I've seen some
Midfoot.
of
Yeah.
those. Yeah,
Hmm.
and especially the joint that is kind of on the outside, the metatarsal cuboid joint, we call that
Hmm.
area. And that's a difficult one to even treat on a fusion standpoint.
Yeah.
Not many doctors will try to fuse that because it's not a natural place to
Yeah.
fuse. But doing the hyaluronic acid injections in there really provides relief. Patients are amazed as what I can do with that, and happy. Well, I can give you some examples, but we can save that for later.
Yeah, okay. Okay. So then yeah, so we're going to talk. Okay. So when does a person need to kind of start seeking medical attention? Would you say for their
Oh,
foot pain, right?
well, shoot.
What are the
Well,
indications?
yeah, number one, foot pain is not normal. Some patients come to me and say, I've had this pain for a year. I'm like, well, why are you waiting so long? They try
Yeah.
different things, ibuprofen, shoe gear changes, changes in activity. Sometimes they stop doing activity because it hurts. And then,
Yeah.
of course, you know how that goes. You stop being active, the other parts of your body suffer. So really, if it's affecting your lifestyle, you should seek help before number one, it gets worse, so you can prevent it from getting worse. Number two, you can get back to your life more normally.
Yeah. Okay. Um so because sometimes like even people that are runners, right? um they kind of start to feel that, well, this pain is just one of the things I have to deal with. I just have to tolerate it, and I'm going to just keep going, right? People with they're just driven, and they're just going to keep going. And at what point do they need to kind of say, okay, well, maybe I need to say podiatrist to make sure I have the right foot care? And in fact, sorry, I'm now going to ask you two questions in one. How many miles should you run in your shoes before you change them? Two questions. Sorry.
Oh,
In
yeah. So number one, yeah, the shoe gear, those tend to break down at about 500 miles. So if you're
500 miles.
tracking your mileage, which most runners will be able to tell you, I'm
Yeah.
running 20 or 30 miles a week, then you can
Mm-hmm.
do the math. 500 miles will come fairly quickly. As an average, if you don't do that consistent running, I just say once a year is a good idea to change your shoe gear. Um,
Okay.
on the other side of things, if you are running every day, you should have two different pairs of shoes so you can alternate. Reason being is that the shoes themselves have what's called a rebound time or a recovery time. The shoe will
Oh.
compress with the use. It takes about
Oh.
36 hours for that rubber to reinflate, to rebound to its normal state. So it's good to have alternating shoes
Get
to prevent
to.
injuries as well. So,
Oh, this is important. I did not know this.
oh,
It
oh,
makes total sense. It makes total sense. Okay, the shoe has a rebound time, so just alternate the guys, right? Okay, and
yep,
if you're not really counting how many miles you're running, then just get one every year. Otherwise,
yeah,
most runners that know what's going on, 500 miles. But yeah, it totally makes sense that there's a rebound time. But I just honestly, I never thought about that. That's good.
yeah.
Get two pairs. Okay, that makes sense.
So yeah, and going back to the initial question, when to see some or to prevent things, yeah, really, if you start with the right shoe fit, that will actually go a long ways to prevent foot pain, foot problems. And it has been proven that if you have a comfortable shoe, then yes, you can eliminate a lot of foot problems.
Yeah, yeah, yeah. Well, as women, we don't necessarily believe in comfort, right? It's about the looks of the shoes.
Well, I
Um,
do struggle
yeah,
with that.
yes. Okay. So and then, would you mind sharing a story with our audience about a patient who had an amazing outcome after being under your care? Someone that really stands out.
Okay, so I have one particular patient who I've been seeing for years because she's a runner and she does, she has the typical what we call a hallux limitus or joint arthritis of the big toe.
Yeah.
Uh, and I get X-rays, examine, and take a look. Well, we can do this or we can do this. Meaning, one, we can do certainly surgery is an option for you, where I can clean up the joint, repair the damage in there, or if you don't want to go, because the process of surgery in a foot, anytime you do any bone surgery, it takes really 2 or 3 months to really recover before you can get back to running. So um, in this situation, I say, well, we can do the hyaluronic acid injections. And certainly said, well, it's worth a try because there's no harm. You're not burning any bridges there. You can try the injections, see how long it lasts. And it turns out I've been seeing her for over 10 years. She comes back once a year for this series of injections and she continues to run.
Oh,
And the joint is
good.
not getting worse. And she's actually able to live her life without having to have the surgery and she's
Oh,
happy.
that's wonderful. That's really wonderful. So my actually, when you mentioned that, so it's a series of three,
Yeah.
right? And
Mhm.
then for some people, it's once a year. Can we do that more frequently than once a year for someone who
Oh,
doesn't
yeah.
have that same? Okay. And is there a
Yeah,
limit?
that's right. There's no limit because it is not a cortisone. Cortisone will provide you pain relief, no question. That is actually one of the standards is to inject a joint with cortisone. But cortisone is also damaging, as you know. So the more cortisone you put in the joint, it will actually destroy the joint.
Yeah.
And in some cases, that's what you do because you want to find pain relief, and then you're already going to a surgical scenario. If you're going into surgery and you know that you're buying some pain time, that's all. But if you don't want to go surgery route, the hyaluronic acid preserves the joint surface, provides more cushion into the joint, and so you can do that as often as you
As
like if it
often as you
provides you
like.
relief.
Okay.
And
Fantastic.
Yeah.
Fantastic. Wow, good. Well, this has been very informative. I have learned a lot, and I'm a rheumatologist, so I've learned a lot. I'm going to get two shoes, 500. I'm not running that much, 500 miles. Try to buy more sensible shoes,
Yeah.
right? And that was a really good story of the woman who's kind of, some people may have felt that they didn't have a choice other than surgery, but there are other options there. There's a steroids, which is on your way to surgery, but hyaluronic acid is definitely an option for patients should they need it. Okay,
Yes.
good. Yeah, so I think that our next question is going to be, how can people find you? So we're both in the Bellevue area. Offices are really not far from each other, but how
Yes.
can people find you, whether in person or online?
Oh, it's well, online. I mean, easy to just type in Dr. Adad. It's similar to your name because it's just in
Yes.
reverse. So Adad, ADAD.
Yeah.
Type me up. My office will show up. I only work out of one location here in
Okay.
Bellevue, so it's pretty
Okay.
easy. Certainly, a phone call. I'm only a phone call away if you like. I don't know if you flash this on your website, but it's 425-861-6254. That's my office number. And then, but most people will find me easily online.
Okay, okay. Well, yeah, and I have your social media handles. So I have your Facebook, I have your Instagram, I have your LinkedIn, I have your website. So, well, yes. So we have many avenues with which people can reach you should they need your help. But this has been so informative. I've really enjoyed talking to you and learning for
Okay.
sure. So, yes. So, thank you so very much for coming to the show. And then, yeah, patients know where to reach you. And then for our audience, if you like this video, share it with anyone that you think would benefit. Anybody with foot pain, share it. Have them see Dr. Adad because there are just multiple ways to address issues. And Dr. Adad is just one of those very experienced physicians with over 30 plus years of experience. So he knows the different options for you. So thank you so much, Dr. Adad, for coming on to the show.
My pleasure. Thank you for having me and have a good rest of your day.
Have a great rest of your day. Take good care.